Gastroesophageal Reflux Disease, or GERD, is a condition where stomach acid flows back into the esophagus, causing discomfort and sometimes injury to the esophageal lining. This happens when the esophagogastric junction, which normally acts as a barrier, fails to prevent the backward movement of acid. The result is a range of symptoms, from heartburn to more serious complications like esophagitis. GERD is not just an isolated issue. It's often influenced by factors such as motility disorders or changes in the anatomy of the junction itself. Understanding GERD is crucial, especially for those considering or having undergone bariatric surgery. Obesity is a major risk factor for GERD. Studies have shown that people with obesity are about 73% more likely to experience GERD symptoms compared to those with a healthy weight. The reason lies in the increased pressure within the abdomen, which pushes stomach contents upward. There's also a direct link between waist circumference and the pressure gradient between the stomach and esophagus. Fortunately, losing weight and reducing waist size can significantly improve GERD symptoms, making weight management a key part of GERD care, especially for those considering bariatric surgery. When it comes to bariatric surgery, several procedures are available, each with different effects on GERD. The most commonly discussed are Sleeve Gastrectomy, SG, and Roux-en-Y Gastric Bypass, RYGB. But there are also other options like BPD, DS, CDS, OAGB, and ESG. Choosing the right surgery depends on a patient's unique anatomy, comorbidities, and GERD status. Understanding how each procedure impacts GERD is essential for both patients and healthcare providers to make informed decisions. Sleeve gastrectomy, or SG, is a popular weight loss surgery but has a strong association with worsening GERD symptoms. After SG, the stomach is reshaped into a narrow tube, which can create higher pressure and reduce its ability to stretch. This may lead to functional stenosis, or twists, and the weakening of the angle of his sling fibers, all of which contribute to acid reflux. As a result, patients may experience increased esophagitis or new-onset GERD after the procedure. This makes careful patient selection and counseling essential before choosing SG. Roux-en-Y Gastric Bypass, or RYGB, is considered the gold standard for treating GERD in patients with obesity. This procedure separates most acid-producing cells from the new, smaller gastric pouch, which reduces acid exposure in the esophagus. It also speeds up gastric emptying and lowers the risk of bile reflux. For patients with severe GERD, or those who do not respond to other treatments, RYGB is often recommended. Its effectiveness in resolving GERD symptoms makes it a preferred choice for many surgeons and patients. Beyond SG and RYGB, there are several other bariatric procedures, each with unique effects on GERD. BPD-DS can resolve GERD in some patients, but may cause new GERD in others. SADI-S, which shares some features with SG, might increase bile reflux risk due to its loop duodenoliostomy. OAGB is simpler than RYGB, but also raises concerns about bile reflux. ESG, an endoscopic technique, seems to offer weight loss benefits without increasing GERD risk. Understanding these differences helps tailor surgical choices to individual needs. Before bariatric surgery, a thorough preoperative evaluation is essential. Protocols can vary, but organizations like ASMBS and IFSO recommend a detailed symptom history and, in some cases, upper endoscopy to identify any underlying pathologies. This helps guide the choice of surgery and ensures that any existing GERD or anatomical issues are addressed. A careful pre-op workup can prevent complications and improve surgical outcomes. After bariatric surgery, ongoing evaluation is important to monitor for GERD symptoms and complications. This typically includes a combination of history taking, upper endoscopy, and imaging studies like an upper GI series. If the cause of symptoms remains unclear, Further tests, such as impedance or pH studies, may be used. A comprehensive approach ensures that any issues are identified early and managed appropriately, supporting long-term patient health. Managing GERD after bariatric surgery usually starts with lifestyle changes and medications like proton pump inhibitors. If GERD persists after sleeve gastrectomy, even with good weight loss, converting to Roux-en-Y Gastric Bypass is often recommended. Other surgical options for post-SG GERD are still debated among experts. The key is a personalized approach, using both medical and surgical strategies to achieve the best outcomes for each patient.